is Smita Kumar, and you're watching Rendezvous with Smita Kumar at Medicircle. Today we have with us Milind Ghyar. He is co-founder and MD at TRIARQ Health. The triple aim of TRIARQ is to bring in health reform, better health, better care, and better economics by intelligently aligning quality and spending in order to achieve the goals of better outcomes and sustainable healthcare for the communities they serve. Milind co-founded GloStream and is a technology-based healthcare expert. He's also he's an entrepreneur and a mentor. Hi, Milind. Welcome to Medicircle.
Thank you, Smita. Thank you for having me. Pleasure to speak with you.
So tell us, how did you enter the healthcare technology sector and how has the journey been?
Sure. Started a long back, 2001. I was doing a project with one of the healthcare companies in East Africa, Kenya. And that was the point where I started really getting interested into what healthcare technology means. So I did a lot of work around that time with few global companies. And then in 2004, I happened to co-start or co-found GloStream, which primarily was an electronic healthcare development company. So we developed a software that basically helps manage the patient health records. Okay. And then the journey started. So we started with a mere small size team of 4 or 5 people at that time, and then gradually have grown to the current size. So it has been an amazing transformation. It went through its own curves and path. GloStream was a healthcare technology driven company. And then later on, around 2011-12, we started to do a lot of work around revenue cycle management and value care. And that is the time when we started rebranding as TRIARQ Health. So it's all one company. GloStream and TRIARQ Health are the same. The company is registered as GloStream, but it's known as or doing business as TRIARQ Health or TRIARQ Practice Services. There are various verticals in the company. Okay. And primarily now I feel that we've come a long way with our journey. We are able to do healthcare technology. We are also offering value care services. We do revenue cycle management. And now we have started forming something called as a MSO or a management services organizations in the US. So in the entire journey, I would say the GloStream part of my journey has been a lot of technology and operations that we created in the US. My audience, my customer has been in the US. And we were able to cater to most of the states, thousands of users right now. So fantastic journey so far.
Wow, glad to hear that. Tell us more about this National Digital Health Mission, NDHM.
Sure. So, recently, if you have followed the news, you must have heard about the National Health Digital Mission, and it was inaugurated by the Prime Minister on 15th August. Before we understand that, I think I'll briefly want to talk a little bit about what healthcare technology is in a small nutshell, so that helps everybody understand. In any of the developed countries, you as a patient never go to the hospital or a clinic and carry your own file. If you see in India, when you visit a doctor, they give you a file and you put all your papers together, and there is a little bit of information written at the end of the file which says that please bring this file the next time when you come. Which means that the onus of evidence or documentation about your health record is on the patient, which on the contrary in a lot of developed countries is that the healthcare provider should maintain the patient records, which does make a lot of sense because, if you carry your own information and let's say if some patient is not in a position to speak about that background, then there is a big problem. So National Health Digital Mission really talks about having an independent patient record. So you'll have a health ID, everybody is aware of Aadhaar, right? So we have formulated our way through Aadhaar, and that becomes almost a national identity now. It's useful everywhere you go. So similarly, a health ID will give you a patient number. And if you have the record with every clinic or hospital, that will help them pull the records of what you have done. And that includes all the patient history that has been entered into the system or the software. Now, what is the biggest advantage of that? The biggest advantage is that the doctor will know specifically what the history is, what treatment was given to you, what is your current medication, what allergies do you have, and so on and so forth. Any of these pointers, if you miss on that information, it could be life-threatening. Imagine a patient with an allergy to penicillin, and the patient doesn't really know, or it has never been documented, and the first shot they get is the penicillin shot, and bam, they'll get a reaction, which could be life-threatening. So this could be avoided. So that's the first part of it, creating an unique identification. The second part of it is really the ability to access healthcare records across the nation. So if we can envision this correctly, you have to think of the ability to go to a clinic and they ask for your number. They enter the number and they'll have the patient record. They'll also know what you have done, what your allergies are. They'll also know about the other visits that you've made. So let's say if a patient goes to a clinic and they have visited a hospital 15 days back for some treatment, they will be able to see those records, right? The advantage is that whatever treatment they're currently going through for say a chronic disease versus say a surgical episode, they will be able to ingest that information and have a very clear guidelines on what the patient should do or not do. The third aspect of this information sharing is really collect a lot of data, which will provide better patient care. It's both in terms of quality as well as in terms of the ability to do it at a economical cost. Because if we don't follow any of these things, you mentioned about the triple aim, and that's exactly the triple aim is all about balancing quality and the cost of the care. So similarly, I think probably a year or two back when we launched the Ayush measures, and there was an announcement about the possibility of a lot of families in India getting insured for a sum of money, and they will get or they'll be able to entitled to take free healthcare treatment, or that will be part of the insurance. You can see in that such situation, it's very, very important to have proper health records. Otherwise, money could be misused, and then the problem that in a country like India we have historically seen is that the benefits do not reach the right kind of people who are entitled to it. So that could be a major problem. So if we connect all these dots together, we'll be able to really transform the way healthcare is done in India. That's in a nutshell. We can go on and on.
Yeah, but I think in India, healthcare is truly diversified. It has like so many platforms: patient visiting pharmacies, then patient visiting GPs, consultants, and there are so many electronic healthcare records which are actually not at all documented, not at all digitalized. Whereas in all in the developed countries, they have one EMR, one patient record, and they have the entire health records of the patient in one go. So I think it would be really great. I think as a healthcare IT company, even we have the Sandbox webinars. Sandbox is also another drive which they are actually coordinating with all these healthcare IT companies so that they have one platform where they can integrate with different platforms. So, and the information on the patient can be seamlessly obtained by the medical practitioners because they actually need the patient's history to treat them better for the future.
Right. Absolutely.
In your view, how we can tackle the three major prevailing issues of Indian healthcare, which is like availability, affordability, and accessibility? I think these three are the three important and very major issues which are presently there in the Indian healthcare system. So how we can tackle them?
Yeah, absolutely. That's a great question. So first of all, let's talk about the availability part, right? The problem with availability is that in a country like India, you do not have a good patient to doctor ratio. We have very few doctors and our population is skyrocketing. It's going to increase and the problem is we will not be able to produce doctors as fast as the population increases. So obviously we need better technology so people can, if you go in a current scenario, if a patient visits a clinic, a general practitioner who is like our family doctor, as we call them, or a primary care physician, the wait time is about 30 minutes to 60 minutes just to go and see a doctor and take medicine for fever or cough and cold. Now, do we really need to go to the doctor for the basic things? Can that be done through telehealth? Just call the doctor, they already have access to your records, and they ask you a questionnaire, and based on that, some calculation is done. You're told to do, take this medication for 3 days, and we'll monitor you remotely. So accessibility, one of the best way to solve that problem is the ability of telehealth or telemedicine, also known as. The idea is to connect patients and doctors all together. Right? They'll be using one platform. The patient will be able to see the doctor will be able to see the patient. They'll ask, interact, there'll be questions. There are standard guidelines on how that is used. So that can be done. Secondly, we also have a lot of medical devices being invented in India, and if I specifically talk about a few like digital stethoscope, or portable ECG meters, or even like the ability to know your blood sugar at the convenience of your house. These are very, very simple things. If those devices are integrated to your phone, then your phone becomes your primary care physician indirectly. The phone will never be able to treat you the way doctor treats. There are models on the artificial intelligence side which try to help with the medical care, but they will never replace a doctor. So doctors should never be worried about, can technology ever replace a doctor? It is impossible. It will never happen. Um, it will be assisted care, technology assisted care. Plus remote areas where the accessibility, or for some reason the doctors do not want to go, or they're not in that proportion available, there we have seen mobile, like ATMs. There are health ATMs where you can go to the ATM and it does your basic testing, pulse, temperature, body weight, and stuff like that. It tells you how good you are. And then with the primary diagnosis, you'll be able to get the basic medication. So this way, you're connected to the mainstream doctor community of doctors. So that problem could be largely solved with medication. And I also believe that technology or healthcare technology should be introduced into the syllabus for the medical professionals. When they are made or created as doctors, they should be well versed with that. The second part of affordability, if you see the current scenario again in India, the way healthcare is done, I would say, I'll share some of the examples that I've witnessed to friends and family. A moment a patient goes to the doctor or hospitalized for some reason, they'll ask you whether you have a medical insurance. And if you have a medical insurance, usually they would be a little free to conduct tests. If they are required or not will be the judgment and debatable topic. Not everybody is the same, but of course, there could be a small portion of people who may misuse that or abuse that information. So in such cases, if you have traceability of a care path, was this treatment really required? Were these diagnoses really required for a patient? Would really help us solve the problem of, reducing the patient cost, the healthcare cost tremendously. We have seen that the government of India is investing a lot of money into healthcare, and I'm pretty sure the budget will increase in the future. In this case, the ability for us to have technology-driven healthcare will really help the government know where the money is being spent. And one of the bigger beneficiaries for these such programs is really the insurance companies. My personal experience is that insurance companies are the real drivers who want to drive technology, because that helps the bridge between the payer or the insurance company, the provider, the doctor, and the patient. It connects all the three dots together. So I think that should be driven. In terms of technology penetration or usability, I think the government of India or even the state governments can really encourage the doctors to take on more technology, and if they can subsidize it or provide some incentives to do that will be great for everybody, for all the market players. So that really talks about how everything could be coming together. So that is about the availability and the affordability part, right? Now, when you really consider the other aspects, when you consider that all these two come together and the patient healthcare is really better, then automatically we are able to solve all the problems associated with healthcare. Now, there are, again, I would say the classification of any healthcare is based on the general treatment that we require for chronic care or the general problems usually we have. And then we have the problems where somebody is really hospitalized. Now, when hospitalization is made, we can collect a lot of data and compare how a certain episode was treated. For example, let's say a cost of knee replacement. I'll just make it up here. The cost of knee replacement is 2 lakh rupees, right? Now, is that 2 lakh really a fair cost, or is it 5 lakh or 10 lakh? How do you know? If we collect all the knee transplantation surgeries or knee replacement surgeries that were done across the nation, and if we have that data, it will be very easy to plot all the data analytics and derive to a conclusion on what the fair practice is or what the fair price is. So that will really help us again, with that dimension.
So I think this would also bring some standardization in healthcare, which is presently not at all prevailing.
Right. It is. If you ask me, my biggest worry about the National Health Digital Mission is the standardization and the compliance. I think that's an area where, as a country, we have to take massive steps. I do know there are programs going on from the government of India where they're working on guidelines, but it has to be, again, incentive driven. How do you incentivize a doctor to participate in technology? And not only that, it is governed and the compliances are in place, and there are agencies who can take care of that. Sometimes lack of agencies is also a big problem. Healthcare, there is standardization is a huge issue, whether it is medical devices or electronic health records. And I think that needs to be overcome. That can happen. We probably need like a compliance department that prescribes guidelines, and then we know what to do, and then everybody follows them because they have to get certified. We say that any technology that you use after every 1 year or 2 year, 3 years, you have to get certified and make sure that it is secure, it is safe, it is up to the mark with the recent standards.
I think there are a lot of bodies already there in India, but I think they need to work full-fledgedly. Like IRDA is there, and I think they have implemented from June 2016. There has to be some formats in which all these healthcare facilities must provide the bills to the patient, not in any other format which they feel that it is correct. So in terms of that, again, there is no kind of standardization. But when standardization is there, I think we can bring better reforms in terms of rates, whatever is offered to the patients across the nation. Also the kind of quality of the services, and the kind of services, and also the quality of services. So I think it would definitely impact big time if it is implemented, correctly.
Yeah, absolutely. One thing that I would bring up here is if you see the technology and internet penetration, if you see last 7, 8, 10 years, the availability of internet has really transformed things. When I started my business, and we did try to approach some local community doctors here, the biggest challenge with healthcare technology deployment is the ability to have all endpoints connected, right? The clinic should be connected to the pharmaceutical store. The pharmaceutical store should be connected to the lab. The lab should be connected to the hospital, right? They should be connected to the patient. The patient should be connected to the physiotherapist. When they all are connected together, then you will be able to provide efficient patient care and at great quality and affordable cost. Now, if internet would have not been there at the rate at what it is today, then these are all distant dreams. It would be very difficult to achieve that. But
right.
The way bandwidth is available and smartphones are available now, it's a lot easier to do.
Yes, very much. What are the benefits and challenges of the digital healthcare system in India?
Benefits, I think we've spoken a little bit about them. I think if I think from a patient perspective, the biggest benefit you get is you don't have to worry about, I have seen a lot of paranoia patients where they have certain, they have either a pre-existing illness or they have a pattern and they had a reaction at some point and they're always scared of that. At the back of their mind, they're always worried about what if this happens again. Whereas if that goes into a patient record and any doctor who is going to treat you gets access to all of your previous records, it's going to take away the risk tremendously. Second, the availability of technology will really make it convenient, right? Today, like I said, especially what has happened around COVID, it's a new world altogether. We have seen how the world has transformed and we all want to be home as much as we can. So, and we were able to figure out anything that you would have said in 2018 or 19 that can we do this remotely, the answer would have been no. But in last 6 months, we have pretty much learned to do everything remotely. So why not patient healthcare, right? Why not healthcare, right? Healthcare is the most lagging part in technology. We do online banking, we do online reservations, everything is online. We do online shopping, we do online grocery, online milk. The only thing we don't do online is healthcare. And that's the problem. That's the problem we're trying to solve. That's the problem about 200 companies in India are trying to solve. So, the convenience is the biggest part. I think a lot of elderly population who do not want to go and visit routine checkups, even the clinic in the current situation, they will be able to do that with a lot of these technologies. So there are a lot of benefits. Hospitalizations, the episode management within hospitalization, cost, quality care, everything is going to be a lot better. Plus, the accessibility for the rural healthcare is really going to benefit tremendously from this. Because then a doctor sitting in a city like Mumbai or Pune will be able to give a little bit of their time to even a remote village in Uttar Pradesh or some other state, just because it is connected, right? Which otherwise would have been very, very difficult. So benefits can go on and on and on and on, right? It's amazing. Challenges, I would say my biggest concern is going to be the compliance, because if there is no compliance or if there is no framework for the ecosystem to sustain, we would have a lot of nuisance and we may have some misuse of technology also. One of the examples, you probably heard this many times, is that credit card data is stolen, right? Or your private information gets stolen. What if your healthcare information gets stolen? Because we have the right to privacy to maintain our patient records, which are only for ourselves and our doctor. So there are protocols and standards and measurement and technology methods to make that data secure so it is not shared publicly. We need to take care of that. The second part of digital health records is usually seen that the doctor and the patient needs to build the trust, right? And those guidelines have to be followed and everybody has to maintain that. Now, one challenge that may happen is that when you are exposing a care path, that a certain diagnosis or treatment needs to be done with A, B, and C, not everybody is going to agree to that because they practice medicine differently. So there could be challenges around that. So we need some standardization compliance around it. Medical devices, compatibility with insurance plan. Again, these people, they have to come on board. It is a problem that needs to be solved by all the players of the ecosystem. When everybody is committed and involved, we will have a lot of resolutions to these challenges.
Sure. What is the scope of personalized medicine using saved data in a healthcare scenario?
Yeah, so that's again a very interesting topic. To understand personalized medicine, we should understand the basics also. Not every person or not every human body or DNA is same, right? Everybody is different. Everybody's parameters are different. A medicine that can be given to me may not work for my brother or somebody else. So how do you know that what works or what does not work? So we need a lot of data computation for that, right? And it's an area that involves, so one of my major areas of research and the work that I'm doing is largely about medical data analytics. We do data analytics on the financial side, we do data analytics on the clinical side. When you do data analytics on the clinical side, what you're really doing is identifying a lot of diagnosis and treatment plans and how a patient was treated. And then you come to understand what the traits are. Now, when you are able to map the person's body structure or characteristic, again, I'm trying to not go too much into technicals here, but overall, the DNA mappings and everything, what works for your body that makes you unique. And if that is mapped with all the problems, healthcare problems you face, it will be relatively easy to diagnose and solve those problems in the future, especially for some of the very difficult treatments for terminal illness or some highly complex diagnosis. There are areas where something may not work for a person versus the other person. So in such cases, there is always scope for personalized medicine. So you have all this data, you try and apply a series of data analytics over it, and what you will get is what constituents are really going to work for a particular patient, right? Even simple test can do that, and that will help us define. Not everybody will have that done right away, but I do see that in many few years to come, we could be in a situation where I am really getting a medicine that is only manufactured for me and shipped to me and that I consume, which is unique to me. Okay? That is not far away, but in order for us to get there and take the most benefits of that medication, we really have to think of digital analytics. Data is the key. If you have a lot of data, right amount of data, it will work. Another aspect to personalized medicine, there are two ways it works, right? One is the addition and one is the elimination. So whenever somebody is not feeling well, we give them medicine. So we are adding something that they have to start doing. And in some cases, you start eliminating things from your life, right? Somebody who is diabetic and their glucose levels are high, doctors will recommend them to consume less amount of sugar. So they are eliminating that part, right? So data analytics will also help in defining what you need to add, what you need to eliminate, and you can maintain your own records. You can start entering, what did I eat yesterday, or did I walk enough? And there are gadgets, which help you do that. And that will tell you whether a certain type of medicine is going to work for a certain group of patients or not. So these studies will be very, very important.
That's really great to know. So I'll just wrap it up here. It was really great talking to you, Milind. And thank you so much for joining us at Medicircle and sharing your insightful views with us.
Thank you, Smita. Thank you for the opportunity. I'm happy to share my thoughts. And this is a great world. You're doing a great job with promoting everything. So thank you. Nice talking to you.